Hello, this is Kim McAllister, and today we're going to be talking about decongestants. This is part 2 of the chapter on upper respiratory tract drugs. So we're going to discuss decongestants, and patients take decongestants when they have excessive nasal secretions, and this is caused from inflammation of the nasal mucosa. And this happens when patients have a cold or they have an antibody or an antigen response that stimulates the immune system. This causes inflammatory mediators to be released, and mast cells will degranulate and release other inflammatory mediators. And this causes the blood vessels in the nasal mucosa to dilate, and this allows fluid and proteins to leak out and move out into the tissues. And this fluid moving out into the tissues causes the tissues to swell and become inflamed and irritated and produce mucus, and this produces the nasal congestion that we all experience, unfortunately, when we have a cold. So the primary causes of this are allergies, the exposure to an antigen, or an upper respiratory tract infection. So we take decongestants or administer these when patients are having these problems. And there are 3 main types. We have adrenergics such as ephedrine, Sudafed. We have anticholinergics that aren't used quite as often. And we have corticosteroids that are given intranasally or topically to the nasal membranes. The advantages of taking the corticosteroids this way is that they provide relief, and they even are a preventative for people that have chronic problems with their upper respiratory tract, and they also are not generally absorbed into the systemic system, so they don't have the same type of systemic effects that patients experience with oral or parenteral steroids. So decongestants come in 2 forms, which are oral or inhaled or topically applied to the nasal membranes. The advantage of oral decongestants is that they have a prolonged effect, and they don't cause a rebound congestion like the inhaled decongestants do. And the oral decongestants are exclusively adrenergics, and so the common medication that people will take is Sudafed for decongestion. And the generic name for Sudafed is pseudoephedrine. And there are a whole variety of trade names for that. The topical nasal decongestants have a very prompt onset. The oral is a little bit slower but lasts longer. The topical act faster but last shorter. And if you continue using them, the amount of effective time gets shorter and shorter, and the rebound gets worse and worse. And so patients will take more and more and more of it, leading to more problems. This is the rebound effect. And so they generally don't recommend that people take these for more than 3 to 5 days. Patients with heart problems or other issues need to discuss with their provider before they take these, and generally they're restricted to taking them for 1 to 2 days. So your inhaled intranasal steroids and anticholinergic drugs don't have the rebound congestion, and these are usually used chronically, so they're not going to have this immediate effect that the adrenergic medications do, but they will provide some preventative for patients. So your topical nasal decongestants are medications like ephedrine. Your intranasal steroids are things like Becanase or fluticasone, which is Flonase, or Nasacort. You may have seen these over the counter in the pharmacy or on TV ads. Your intranasal anticholinergics are Atrovent. So the site of action for these are the blood vessels surrounding the nasal sinuses. The adrenergics will constrict the small blood vessels and help to relieve the congestion by shrinking the tissues. It reverses that effect of all of the fluid leaking out, and it constricts the blood vessels down, and so then the tissues will shrink, and then the mucosa is able to drain and airflow is better. The nasal steroids have an anti-inflammatory effect, and they turn off the immune system mediators that are in that area and stop the inflammatory response. And so by decreasing the inflammation, the congestion becomes decreased. The general effect of all nasal decongestants is to shrink engorged nasal tissue and also relieve the stuffiness, allowing people to breathe better. They are used for people experiencing acute or chronic rhinitis, the common cold, sinusitis, hay fever, other allergies. These are the things that they're used for. They can also be used just before surgery or before some type of invasive procedure that's going to happen through the nasal passageways. Administering that just before surgery will shrink the tissues and provide less bleeding and better visualization. Again, just like any other medication, if patients are allergic to any component of the nasal decongestant, then they should not take it. And it's very important to do a thorough history on drug allergies and find out what kind of problems people have had with these medications if they've taken them before. Patients who have some type of microvascular complication like diabetes or glaucoma, uncontrolled cardiovascular disease, hypertension. Remember, these medications are shrinking tissues and shrinking the blood vessels. So when we constrict blood vessels, it can cause problems with these other conditions. Again, people with a cerebral vascular accident, which is a stroke, or a TIA, transient ischemic attack, again, we don't want to obstruct blood vessels. We want to keep them open for patients with these issues. Patients with long-standing asthma, benign prostatic hypertrophy, because these medications also can restrict urine, that's not a good thing to give someone with prostatic hypertrophy, as we discussed with antihistamines, and diabetes. Also, diabetes causes extensive microvascular problems, and so again, we don't want to administer something that's going to shrink those vessels. So the adverse effects of nasal decongestants, if patients are taking an adrenergic medication like Sudafed, they can become very nervous, have difficulty falling asleep. They can have palpitations, irregular heartbeat, and tremors. And for steroids, it can cause a local dryness and irritation. And interactions, if patients are taking an adrenergic oral medication and an adrenergic nasal spray or topical medication, they're more likely to have some type of drug toxicity when they're given together. Patients taking MAOI inhibitors need to discuss with their provider before they take it. It can cause an increase in blood pressure if they take that with their MAOI inhibitor. Also, patients with heart problems, stroke, diabetes, and so forth, they need to talk to their provider about all over-the-counter medications also. Patients should avoid caffeine and caffeine-containing products. Again, we don't want to overstimulate the patient. If they're having problems and symptoms of their cold for more than 1 week, they need to contact their provider. They may have a more serious condition. And as nurses, we need to monitor for intended therapeutic effects. That's part of the evaluation process of the nursing process. Thank you. This is the end.